Now we will be discussing about the general principles or the general prescribing guidelines for pediatrics. As I was telling you, the pediatrics is a branch of medical science which deals with the development, disorders associated with the pediatrics and diseases in children. So whenever you think about the pediatric age group, you should think about the 3 Ds, which is nothing but the developmental milestones starting from the birth of the child or preterm of the child still when the child attains the age of 16 to 18 years as per ICH guidelines. So the developmental milestones and their disorders, associated disorders, the disorders may be if you take the account of or example of the global developmental delay disorders, or you can take the account of, you can take the definition of the cerebral palsy, where we can see the developmental delay in the children's. So, and diseases which are associated in the children. So a pediatric is a branch of science, medical science, which deals with all the 3 Ds. Okay, so when we compare with the extent of the research work done on the adults, the extent of research work done in the pediatrics is less. So even the available formulations are, when compared to adult population, the available drug formulations are a bit lower in case of pediatric populations. So careful monitoring as well as the drug designing a dosage formulation itself is a very difficult task, and designing a dosage regimen, it needs very careful consideration before giving a drug therapy to the pediatrics. We will see what and how the most caution method has to be taken in case of pediatrics. As I was telling you, in children the organs are not fully developed. Whether it may be the liver, which is meant for metabolism purpose, which is not fully developed, and the various body systems, and the very important thing we should see, the enzymes are low in concentration. So the drug handling capacity is greatly reduced in case of pediatrics because they have the low rates, metabolic rates, and the drugs formulations or drug dosage has to be reduced because the lot of alterations, when the drug is given, their response to the drug will be varied, and when the response is varied, and they are more likely to suffer from ADRs, that is adverse drug reactions. So the utmost care should be taken while giving or while designing a proper dosage regimen in case of pediatric populations. I have told you the childhood is mainly divided into 3 stages. The 3 stages like neonates, first 30 days of life, infants 1 month to 1 year, and child 1 year to 12 years. And if you go to the ICH classification, that is International Committee on Harmonization for the conducting clinical trials, the age group are generally categorized into 5 different categories. Firstly, you can see the preterm newborn infant. Second, you can see the term newborn infants, where the day ranges from 0 to 27 days. And in the third category, infants and toddlers, where it ranges from 28 days to 23 months. And lastly, you can see the children's, which starts from 2 to 11 years, and adolescents from 12 to 16 to 18 years. This is the ICH classification, which is meant for conducting the clinical trials. As I was telling you, the neonates have increased risk of toxicity due to inefficient renal clearance. So the renal clearance is drastically decreased because the renal tissues, the renal organ is not fully developed, the kidney is not fully developed. So the child, certain drugs may behave toxicity in the children. So the risk of toxicity in case of pediatric age group is a bit higher. And we can see the relative deficiencies of enzymes. I told you that there are deficiencies of enzymes because liver is not fully developed. So children, they greatly pose the risk of the toxicity, because I told you the liver is mainly meant for detoxifying agent. The liver is the organ which detoxifies. So many phase 1, phase 2 reactions will take place in liver organ, and it detoxifies. But when the liver is not fully developed, in case of pediatrics, they are main posed to the risk of toxicity. So generally the dose is calculated from the adult dose using age, body weight and body surface area, and the combination of these three factors, whether it may be depending upon the age, depending upon the body weight basis and body surface area basis. These factors are used frequently to calculate for dosage regimen in case of pediatrics. Now let us discuss all these three basic principles of designing dosage regimen to the children now. Firstly, we'll start with body weight basis. So it is usually a parameter which is calculated for designing a dose for which is generally expressed in milligrams per kg. So whenever you want to design a dosage regimen to a pediatric baby, it will be always expressed in milligrams per kg. The ideal body weight is calculated for the administration of dose in obese children as well as children with high metabolic rate, where those children are taken into consideration where metabolic rate is very higher. Generally in all hospitals, the body weight is considered as general guidelines for designing the dosage regimen. Coming to the body surface area, it is also called as BSA. Other than body weight basis, sometimes the dosage is calculated on the body surface area, which is mainly reliable method for calculating the dosage in children in case of the oncology, in case of designing dosage regimen for the anti-cancer drug preparations. There are many practical problems which are arising when child is critically ill. The body surface area is calculated by using the formula. We can see the formula. The body surface area is equal to the square root of height, which is usually in centimeters, into weight in kg upon 3600. This is the formula to calculate the body surface area. It is square root of height in centimeters in weight multiplied by weight in kgs divided by 3600. Now the average body surface area of a 70 kg adult is about 1.7 to 1.8 square meters. From the above equation, the approximate dose for the child can be calculated like surface area of child, which is in meter square, upon 1.8, which is, I told you, the average weight of a 70 kg weighing adult, and his average body surface area would tend to be 1.8 square meters. So 1.8 is taken here, which is multiplied by adult dose. You will be getting the approximate dose for child. This is nothing but to calculate. First, the body surface area is calculated. Based on that, the surface area of child is calculated, and dosage of child is calculated accordingly on the base of the adult dose. Apart from body weight or body surface area, there is another method used for calculating the dose of children, that is percentage method. So generally the percentage method I will just skip it. Let me tell you the percentage method. Here you can see the age wise starting from 1 month to 12 years, and here you can see the ideal body weight, which is given in kgs, height in centimeters, and body surface area always it is denoted in meters, and percentage of adult dose, where you can see the body's ideal body weight, which starts from 3.4 kg, and height in centimeters 50 centimeters, and body centimeters in case of children would be 0.23, and 12.5% of adult dose is taken here in case of newborn. In similar pattern, in 12-year-old who is weighing around 37 ideal body weight in kg, the child may be around 148 centimeters, body surface area is 1.25 meters. So 75% of the adult dose is taken in case of children who is around 12 years of age, and he should weigh ideally around 37 kg. In this way, it is calculated, percentage method of calculation of the body weight on the percentage method. Now we will see some of the other formulas which is meant for calculating the children's dose. There are three different formulas which are for calculating the dose. One is Clark's rule, other one is Freud's rule, other one is Young's rule. These are three rules which are applied for the pediatric age group depending upon the different situations. You can use these different formulas for calculating the children dose. If it is in pound, you may take this Clark's rule, which is weight in pounds into adult dose divided by 50. If it is in months and it is in age is given in months, you know, and you can calculate the children dose by age in months into adult dose divided by 150 will give you the children's dose. And for Young's, always you think Young's age, because in age in years into adult dose divided by age upon age plus 12 it is. Okay, age in years multiplied by adult dose divided by age plus 12 will give you the Young's rule of calculating the children's dose. All the pharmacokinetic parameters like absorption, distribution, metabolism and excretion must be strictly observed before starting the drug therapy in children. Now let us understand the different absorption, distribution, metabolism and excretion process. As I told you, the body is just like behaving like different compartments. Okay, so KADME. Let me write it and let me understand. Let me take you to the understanding this thing. So how in which way the thing is written now. Let me take this one. So K A D M and last is E. So the K stands for pharmacokinetics, that is kinetic profiles of A, D, M and E. So the kinetics, which is nothing but the kinetics, means the movement of drugs from one compartment to other compartment. That is, the compartment may be absorption, how the drug is absorbed, in the body, how the drug is absorbed. So the movement of drugs in case of absorption, distribution, how the drug is distributed in the tissues, now how the metabolism is taking place in the body, how the drug is excreted, whether drug is excreted through renal route or there may be any other routes if necessary, if at all. So the kinetics of drugs of A, D, M and E, which is nothing but the pharmacokinetic parameters, which we'll be studying briefly. Let us move to the absorption pattern. The various routes of absorption are, we will see the various routes. Oral route, one is oral route. The oral absorption of drug in the children depends upon the gastric and intestinal transit time. The gastric contents, pH and the content, and the transit time. The transit time is the time which is taken for the intestinal, how much time the drug is there in the intestine, how much time it is taking for the drug in the intestine. So how much time drug is remaining in the intestine medium. The other factors which influence the oral absorption in the children are the posture, disease state, presence of any disease state, and the therapeutic interventions like nasogastric aspirations or any other drug therapy. The gastric emptying time in children will equal the adult functions only in 6 months of age. Please do remember this very important point. So whenever the child attains more than 6 or 8 months, his gastric emptying time will be equivalent to adult function. So he can definitely function very well only after attaining the age of 6 months of age. Similarly, the gastric output in children gets equal to adult gastric output only after child is attaining the 2 years of age. Okay. In case of bioavailability of certain drugs like digoxin, sulfonamides and phenobarbital, the rate of absorption in neonates is very slow when compared to infants and children. We will see in the next video.